Thank you.
I thank the member. The question is the motion be agreed to, and I call the member for Goldstein.
Thank you, Deputy Speaker. And Deputy Speaker, I think everybody in this chamber believes fundamentally that we want a country that is prosperous, that is safe, and that is healthy. And the government plays a critical role in creating the structures and framework for a free society. And as part of that, we also have an ambition that we have a healthy population with a just system that addresses issues of equity to make sure that people can get access to critical and basic health services so they can live out the fullness of their lives. Now, that point has become debated at different points about how it's best to achieve that. Now, at present, we have the Medicare system. And the Medicare system has never had a better friend than the Morrison government, where we have consistently delivered year-on-year funding, year-on-year increases in the number of GPs who bulk bill, and year-on-year better access to healthcare services that Australians need. Now, let's not misunderstand, Deputy Speaker. In this place, there are people who feel they have a monopoly on compassion and believe that everything they do can never be questioned. They're called the Australian Labor Party. They sit on the opposition benches because their disinterest in outcomes for Australians always comes second to their own ambition to claim credit for their own relevance. But the reality is, and the numbers show, that we have seen consistent increases in Medicare funding and in consistent outcomes in bulk billing rates. That's the hard numbers. Compared to the last period, the same time last year, the GP non-referred attendance bulk billing rate was 86% this year, up from 85.8% last year. The specialist attendances bulk billing rate was 31.4%, up 30.9% of the previous year. And the total Medicare bulk billing rate was 79%, up from 78.7% last year. And we know that for those people who need extra assistance and support, who need to be able to go to the doctor and not experience a co-payment, well, we can just trust the Australian Institute of Health and Welfare that found that more than half of all patients, about 11 million Australians, incurred no out-of-pocket costs for non-hospital Medicare services in 2016-2017, the most recent data. And what we know is we see this on the ground in our communities. Now, of course, Labor members come into this chamber and talk about why only they can be the solution, even though they have never been the solution to these issues. And we know this in Goldstein, where we got no commitments of support or funding or additional commitments to Medicare or essential health services at the last election from the Australian Labor Party. In fact, we didn't even appear on their radar. All they wanted was to harvest the electorate of Goldstein for votes in the hope they'd be able to get a third Senate candidate. They failed at that, but that's a separate issue. Whereas the coalition has taken a very proactive step in making sure that Medicare services are provided to the communities based on need. And what we saw at the in the lead up to the last election was new MRI licences for Cabrini Hospital in Brighton, as well as for Holmes Glen in Moorabbin. That meant for the first time, residents of the city of Bayside who have cancer, stroke, heart and other medical conditions can get scans locally rather than having to travel. The licence is expected to deliver approximately 5,900 Medicare subsidised services annually at a cost of $2.24 per annum. This, of course, will save lives, decrease costs for patients and increase access. And on my very first visit to Cabrini Brighton, when I was first elected a member shortly after the 2016 election, they had one request, which was a Medicare-funded licensed MRI. And we were able to deliver it through strong and effective advocacy, but also because this government understands that the foundation of a strong health system is a strong economy. If you have a strong economy where people are paying taxes and contributing to stand on their own 2 feet, they're in the best position to turn around and help those who are not. We're able to have the resources we can to deliver record Medicare funding, record health outcomes for Australians, and, of course, to deliver essential local services like a Medicare licensed MRI in Goldstein.
I thank the member.